Okay guys, my name is Dr. Rachel Sue and I am a veterinarian and I'll be telling you all about my job today. So a little bit about me. I do have a little social media here if you want to follow me and see more of what my day-to-day life is. I have some surgery videos on here and pet information. But I do work at Carrollton West Pet Hospital, which is just around the corner, about 5 minutes away. I see everything from dogs, cats, birds, reptiles, and small furry creatures like rabbits and ferrets. So what does a veterinarian do? Well, I diagnose and treat illnesses in animals, and I prescribe medications for various conditions. I perform routine checkups and administer vaccines. I do surgery, such as spaying, neutering, dentals, mass removals, and some others. And I monitor anesthesia during these procedures. I provide emergency care for injured or sick pets. I offer advice on nutrition, behavior, and preventative care. I perform diagnostic tests such as blood work, x-rays, and ultrasounds. I manage chronic diseases such as diabetes or arthritis in animals as they get older. And I educate pet owners on proper pet care, hygiene, and lifestyle. Another thing that people don't think about is that I do keep medical records of all my patients. So how does reading, writing, math, science, and technology help me in my day-to-day life? Well, science is a big one. Anatomy, biology, physiology, these are the foundation for understanding the body and how to diagnose different conditions and treat them. Math, I use all the time, whether it's calculating anesthetic medications or filling prescriptions for pets. Reading, I use it all the time. I'm always researching new information and writing medical records. Technology. So I use technology with ultrasounds, blood tests, x-rays, and CT machines. And then communication is something people don't really think about. But as a veterinarian, I am talking to pet owners the entire day, whether it's just telling them about my physical exam that I do on a patient or, breaking some bad news. It's nice to be able to communicate effectively with pet owners. So this is an elephant that I worked with in Thailand. So some frequently asked questions. So what type of veterinarians are there? I'm a general practice veterinarian, so I see dogs, cats, and small, pets. But there's a lot of different veterinary fields to go into. There are zoo veterinarians, so vets that work at zoos and work with elephants and tigers and bears. There's equine-specific veterinarians that only work with horses. There's veterinarians that only work with large animal or farm animal or food animal species. So think goats, cows, pigs. There's veterinarians that only do research in a lab, and they don't work with people at all. There's specialist veterinarians. So just like there's different types of doctors for human medicine, you can specialize and do that field just for pets. So cardiology or heart doctor, ophthalmology or an eye doctor, oncology or cancer treatment doctor. So what education do you need to become a vet? Well, I did 4 years of undergraduate college after high school, and then I did 4 years of vet school after that, and then you pass a national exam. Now, after doing that, you can be a basic veterinarian. You work with, small animals or, farm animals. But if you want to specialize, then there's additional training you can do through an internship and residency, which would be an additional 4 years or even more. We're always learning, so there's also continuing education. Just because we graduated vet school doesn't mean there's not more to learn. I am always looking things up, or there's new medicine that's coming out that we need to stay on top of. What is my typical day like? So as a general practice veterinarian, I work from 8:30 to 6, about 4 days a week. I do surgeries in the mornings, and then I see patients in the afternoon. And these patients can be wellness appointments where I'm giving vaccines, or seeing sick appointments where a pet comes to me and they're not feeling well, and I got to figure out what's going on and treat them. Work-life balance is possible, but it really depends on what field you go into. As a general practice vet, I have a good work-life balance, but things like zoo medicine, which are really competitive and have long hours, can be more difficult. Now, what qualities? That's a giraffe. This was in South Africa. Now, what qualities are helpful to be successful as a vet? Being a problem solver is a big one. Our whole job is centered around figuring out what problem is affecting an animal and being able to treat them. Having resilience is important. Being able to push through and stick with it, even when times are tough. Vet school is tough. You got to study a lot. You got to study hard, but being able to work through it is helpful. Empathy is extremely important. I'm talking to pet owners every day, and some of the conversations we have are difficult. Sometimes I have to break bad news when a pet isn't doing well and might not get better. Or sometimes we perform euthanasias, which is when we put a pet to sleep at the end of their life if they're suffering. Now, these can be hard, but being able to empathize or sympathize and feel for the owners and be caring towards them really makes you a good vet. Being extroverted is helpful. Now, that being said, a lot of vets are introverted because we love animals, and a lot of vets, aren't the biggest fan of people, but actually being extroverted helps because we're talking to people every day, all day. So if you're introverted, that might tire you out. If you're extroverted, it might be more beneficial for you. Being able to stay calm under pressure. Now, sometimes our jobs are stressful. Doing surgery can be stressful. A pet is depending on you to keep it alive under anesthesia and perform the surgery properly. If things go wrong, you need to be able to keep your cool and figure out how to fix it. Or if a pet comes in with an emergency, you need to be able to think about what to do first and prioritize things and take care of them. So it can be a stressful job, and staying calm under pressure is important. Now, what about euthanasia? I often have people tell me that they love animals, but they couldn't be a vet because they don't want to ever put an animal to sleep. And I'm not going to lie, this is a hard part of our job, but I've come to terms with it. And how I view it is that if an animal is suffering, euthanasia is a gift that we can give them to make sure that they have a peaceful passing. Because at the end of pets' lives, it can be a long, drawn-out process, and they can suffer as they're passing. So why not make sure that they have a peaceful one? And it can be sad, but it's the last kindness we can offer a pet after giving them a lifetime of love. So although it's hard, I don't view it as a bad thing, and I view it as a privilege that we can give our pets. Now, how did I get into veterinary school? Well, I majored in biology. Science is always a big part of vet school. But you could really major in anything as long as you get your prerequisites done. Grades are important, so study hard. They're not everything. Experience is also helpful, but it's good to work hard and study well. Volunteering and shadowing experience will also help you get into vet school. So if you can shadow at a veterinary office or work as a technician during the summers, or volunteer at an animal shelter or a wildlife refuge, all of these things will give you experience that vet schools look for in applications.
Why is the cat so long?
That's two cats. Oh. Yeah, they kind of blend into each other. And that's a bat right there. Mm-hmm. I'll take questions at the end. Oh, okay. So what can you do to help pets? Number one, just be kind to animals. And not just dogs and cats or the furry creatures, but be kind to everything from snakes to birds to spiders. They all have hearts and brains, and they feel pain and they feel love, and so just be kind to them all and respect them all. Take your pets to the vet regularly to keep them healthy. A lot of pet owners don't realize their pet's sick until they bring them to the vet, and we are able to use our experience to find something that they may have missed. Keep them vaccinated to prevent them from getting sick. Shots are important for you and for pets. You can protect them from contracting parasites like heartworms, which are passed by mosquitoes, and fleas and ticks by giving them their monthly prevention. You can take care of their teeth by brushing them daily and getting them dental cleanings, and give them regular exercise. Walks and playtime are great for pets. A lot of pets are overweight, so it's on us to make sure they're eating a healthy diet and exercising regularly. And lastly, volunteer at an animal shelter to pet and socialize animals that don't have that experience. Now we're going to do some fun. We're going to look at some x-rays and play guess what that pet ate. So these are x-rays, and then on an x-ray, black is air or very thin things. White is tissue or dense objects, and the brighter something is, usually the denser or like metallic it is or hard it is. So I'll get you started. This is the spine, these are the ribs, and here's the stomach and intestines, and they're filled with something that's really bright and smooth. So think of something that's really dense and smooth. What do you think? That's close. I'll give you a hint. So this dog ate all of these things after the owner dumped bacon grease in the backyard. So it was outside. What do you think it is? Close. But this is not food. So something hard and dense. Rocks. Yeah, rocks. This is what he ate. Okay, so this pet ate something that looked kind of like a something flat and metallic. It was a magnet. A coin is also a good guess because they look very similar. A fish hook, yeah. This dog ate a fish hook because it had something tasty on the end of it. Is he still alive? So they all got surgery to remove these things. So don't let your pets get into things, but we can help fix them if they do. So it looks like worms, but remember, on an x-ray, black is gas. So this is actually gas that's in the intestines, and that is backed up because it ate something that it shouldn't have. Right here, you can actually see the foreign object. So it kind of looks like spaghetti. It's the same shape, and then there's other stuff here that kind of blends in. I wouldn't expect you to be able to see it, but I'll give you a hint. All of these things that it ate are things that you would wear on your body. What's one of them? It's close. Something you wear in your hair, maybe? A hair tie, yeah. So this dog ate a bunch of socks, hair ties, and underwear. And we took all of this out of the stomach. So this dog ate something round. Mm-hmm. It was let's see, something that it was actually playing with. A ball, yeah, ate a ball. Okay, this one was actually a cat. And yeah, cats like to play with string, but we don't want to let them play with string because string can actually hurt them and get caught in their intestines. But this is a sewing needle that was lodged in the cat's throat. And this one has the answer on the screen, but this dog did eat a corn cob. Now, you might think that it could be a tasty treat for your pet, but they actually don't digest them, so it gets stuck in their stomach. So never feed your dog corn cobs. You can see the outline of the corn cob right here in the stomach. A rubber ducky, yeah. And here is a snake that ate a glass bottle, yeah. Okay, we saw this earlier. Here's a cat this time. A huge rock. The string things. Yeah, hair ties. Ate a lot of hair ties. There's the culprit right there. He did not learn his lesson. A pacifier. Mm-hmm. You can see it right here. Shut up, bro.
Oh, a toy jet.
Yeah.
What the heck?
Okay, now we're going to play Guess the Species. This is an alligator that I was holding.
A chameleon.
A chameleon. And the chameleon had a bunch of eggs in its belly. Yeah, they are reptiles. And so this one had a bunch of eggs in its belly. The eggshells are made of calcium, so they show up really bright on an x-ray.
A chicken.
A chicken. Good job.
Oh, that is?
Yeah, yeah. This is a chicken.
A dog. A bunny rabbit.
No, it's a dog.
Yeah,
and it has a baby inside. So here's the little fetus right here. This is its head, this is its spine, and here's, it was a bulldog, so it's a very stout dog.
Yo. A turtle.
A tortoise, yeah, yeah.
A rat.
A rat, yeah. It's a very fat rat.
You are the rat. You are the rat. You're the rat. A kangaroo. Oh, jackrabbit.
A rabbit, yeah.
Raise your hand to answer.
Okay,
A
okay.
hedgehog.
Yeah, what do you think? Yeah, it is a hedgehog.
It is?
Yeah, you can see the spines right here.
Oh. That was scary.
It's a type of lizard.
A gecko.
A gecko, yeah, it's a leopard gecko. It has little eggs right here. Okay. Yes, that is a snake. Now, this is my last question for you guys. Who knows the difference between venomous and poisonous?
And they smell like cucumbers.
It's not cucumbers. What is it? What do you think?
Oh, that's for copper.
Okay.
So, basically, venomous can actually kill you, and poisonous is like just makes the body ill. Right?
So that's a good guess, and but there's another difference between them. So are snakes venomous or poisonous? They are venomous, and snakes can hurt you by what? Biting you and injecting venom. So the difference between venom and poison is that venom is injected into you if an animal bites you. Poison is if you eat something and it hurts you. So a poison dart frog, if you eat it, it'll hurt you. A poisonous plant, if you eat it, it'll hurt you. A animal that bites you and injects venom into you is venomous. So I'll take your questions now. What questions do you have?